Welcome to Why We Talk. I'm today's host, Dr. LaRhonda Magras, CEO of YWCA Central Alabama. Join us each episode as we speak with leaders and visionaries about what's most important in our community, including increasing access and opportunities and transforming systems and institutions. YWCA is on a mission to stand against racism. We take a stand every day by raising awareness about the impact of institutional and structural racism and by building community among those who work for racial justice. Stand Against Racism provides the opportunity for communities across the United States to find an issue or a cause that inspires them to take a stand and to unite their voices to educate, to advocate, and to promote racial justice. So thank you for joining us. Thank you for this special edition of Stand Against Racism, Why We Talk. Mayor Randall Woodfin, Birmingham's own, joined forces with YWCA Central Alabama by proclamation to observe April 22nd through April 25th as Stand Against Racism Week. Let's watch his brief video message.
Hey everybody, this is Mayor Randall Woodfin. Our city is home to an organization that has been driving change for 118 years. The YWCA Central Alabama is our state's only YW, and I am proud of its dedication to eliminating racism and especially empowering women. You know, our YW joins hundreds of its sisters organizations across the nation April 22nd through April 25th to take a stand against racism. This year, the national campaign is addressing racism as a public health crisis, which it is. By proclamation, our city recognizes the observance and the need to achieve a health equity. YW raises awareness about the institutional and structural racism that underlines systemic health disparities. Racism is a public health crisis, and this fact cannot be ignored. In the U.S., Black women die from pregnancy and childbirth complications at more than double the rate of white women. Coronavirus, cancer, diabetes, and heart disease disproportionately hit people of color. Disparities in health and medical care should not be a worry for anyone, regardless of race or gender. And as a city, we changed the world during the Civil Rights Movement. This is our legacy, and this legacy demands us to take up the fight for the next generation. Let's talk about it, let's raise awareness. Most importantly, let's all take a stand against racism. Thank you.
Thank you, Mayor Woodfin, for this proclamation in recognition of our 2021 Stand Against Racism Week. And thank you for being a partner, really, with us in our mission to eliminate racism and empower women. Before we dive into our topic today, on Tuesday, ex-Minneapolis police officer Derek Chauvin was convicted on all counts in the 2020 murder of George Floyd. The world erupted in outrage after witnessing Mr. Floyd's death caught on video. Many wondered if there would be any accountability in this case, because we have witnessed, quite frankly, far too many times when that was indeed not the case, even with video. We were relieved, if only for a moment, that some measure of justice was served with the verdict. However, many people of color are triggered and having a tough time right now. And it is important to acknowledge this pain and exhaustion and make space for people to do what they need to do to heal from the trauma. Our work continues. I am so honored to speak with two outstanding leaders and change makers here to lend their voice to the conversation we are having this week for our 15th annual Stand Against Racism campaign on the topic of racism as a public health crisis. Our first guest is Alethia M. Jackson, who is Vice President of Federal Government Relations and Head of Advocacy at Walgreens. Ms. Jackson holds a Juris Doctorate degree from Syracuse University School of Law. She has over 20 years experience developing high-impact strategies, structures, and partnerships that shape public policy, elevate brand identity, and advance corporate and industry policy objectives. In her current role, Alethia's objective is to expand patient access to pharmacy services while advancing the role of pharmacy within the healthcare system. She oversees lobbying and chairs a cross-functional COVID-19 vaccine equity task force. Ms. Jackson was honored as a top lobbyist by The Hill for 4 consecutive years from 2017 to 2020, and she earned the 2016 Corporate Citizenship Award by the Congressional Black Caucus Brain Trust. Equally important, Alethia Jackson is dedicated and passionate about empowering young women. So perfect to be here at the YW. She is an active member of the Board of Directors of Running Start, which is a nonpartisan nonprofit group that trains young women to run for public office. She lends her time to several other boards and foundations that champion for the community. Welcome, Alethia.
Thank you so much for having me.
And our next guest is Dr. April Carson. Dr. Carson is Associate Professor of Epidemiology and Associate Dean for Diversity, Equity, and Inclusion at the University of Alabama at Birmingham School of Public Health. Dr. Carson's research centers broadly on determinants of health disparities in diabetes and cardiovascular disease. Although she lives here in Birmingham, Dr. Carson is a Georgia native. She completed her BS in microbiology at the University of Georgia and her MSPH and PhD in epidemiology at the University of North Carolina at Chapel Hill. Currently, Dr. Carson has an active research portfolio that's funded by the Centers for Disease Control and Prevention at the National Institutes of Health. And she is a member of several professional organizations, including the American Diabetes Association and American Heart Association. Welcome to you both. It is indeed my honor to have you join us for this very important conversation. So my first question, this Why We Talk is, as you've heard, dedicated to our theme of racism as a public health crisis. The CDC defines public health as the science of protecting and improving the health of people and their communities. Dr. Carson, I'll go to you first with this first question. What comes to mind when you hear racism as a public health crisis?
Yeah. Well, thank you for the question, Dr. Magras. It's definitely an honor to be here and to be a part of this panel. So when I hear racism as a public health crisis, I think of how important it is to have that declaration as part of this national conversation. As a public health researcher, we've been having this conversation for some time now, but now it's been elevated really to a national stage. And I think this is important because we know that racism is bad for society. But now we're actually connecting it to really the negative and adverse mental and physical health effects that we've seen really for decades, really centuries preceding this. We've known about racial disparities in diabetes and high blood pressure and cancer, and most recently COVID-19. And I think naming racism specifically as a public health crisis is really identifying it as a driver of these health disparities. But also it's causing us to think about how we can take that stand to act to address racism. Because really we're wanting to promote the health and well-being of all people in all communities. And acknowledging the contribution of racism is the first step in moving towards acting on it.
Thank you for that, Dr. Carson. And then I'll go to you, Alethia, to ask the same question and also to maybe add in, so we've known about this for a while. So why now? Why now are we connecting those dots?
Sure. And I'd also like to thank you so much for having me for this timely discussion. It's an honor to be here and to be here alongside Dr. Carson. So, when we look at this, and to echo some of what Dr. Carson said, it really is a moment to, I think, as we look at, and you started by talking about the murder of George Floyd, and it was done in such a way that it shined a light on racism that could not be ignored, because we literally watched someone lose their life, and we began to talk about racism in a much more open way than we ever had, and looking at the systemic effects of it. And racism moves through multiple institutions, and it does have a systemic impact on the lives of those who are victims of it in every aspect, health being one of those, because we look at the social determinants of health, and that's where people work, where people live, what are people's income, what's your access to healthcare, and all of those are impacted by systemic racism and in institutions that do either limit the ability of people to progress, or limit their access in numerous ways, as well as limit the way they are viewed. And so some of the cultural pieces that then tie through to racism, and so how people are viewed by others, whether that's healthcare practitioners or other institutions. And so I think this is the moment that has shined a light on that, compounded with COVID-19, which the science, as we look at how communities of color have been impacted, also can't be ignored.
Thank you for that. That's a great segue really into my next question, which in February of this year, the Centers for Disease Control and Prevention stated that long-standing systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick from COVID-19, but also of dying from COVID-19. So in other words, communities of color are overrepresented in severe cases and deaths. So can you share with our audience why people of color are more vulnerable to COVID-19 risk? And I'll just stick with you, Alethia, first, and then Dr. Carson to answer the same question.
Sure. And it really does tie back again to when you look at social determinants of health, and actually the Centers for Disease Control, and as we've been talking about COVID-19, use a term, and it's social vulnerability index. And it really is an index that measures what places people in a more vulnerable position as we look at public health. And some of those intertwine again with even the discussions we've just had over systemic racism. And so it's what conditions do people live in? Are they living in close quarters? Do they lack access to transportation? Do they lack access to healthcare? Where do they work? Are they frontline workers? All of these placing people at greater risk for one, the virus, the virus not being diagnosed, and for spread of the virus, and potentially not being able to recover from the virus when we pull in health disparities that may have already have people coming into that situation with a compromised health condition, whether it's diabetes, asthma, or others that make it harder to combat the effects of COVID-19. It's something we looked at as a company. We've been doing testing since March, and we deliberately put our testing sites in areas that indexed high on social vulnerability. At least over 50% of our sites were there, because when we looked at kind of who needs access to testing, and our locations were everywhere, but wanting to make sure you are touching those communities that are at higher risk.
Thank you. I was looking in the chat here and just really think, yeah, there are a lot of people who are agreeing, I think, with that sentiment there in terms of vulnerability. And so then I'll just go ahead and ask you the same question, Dr. Carson. I know they're very similar things, but is there more to add there?
Yeah, I'll just pick up on where Alethia left off, the comment that she made regarding their use of the social vulnerability index to determine where they were placing testing sites. I think that's an excellent example of how we address the inequities. rather than just relying on people being able to find a potential testing site. It's really understanding where are some of these vulnerable communities and how can we allocate resources to those vulnerable communities. And she's raised all the key points, really sort of existing health issues, ability to test, ability to quarantine, multi-generational households, access to care, all of those things come into play. But when we are able to make those decisions informed by understanding what the context is, that's how we're able to really help really address not only COVID-19, but other health conditions.
Thank you for that. I heard something yesterday, I think, that had me kind of think about things a little bit differently around the vaccine. And so I want to get your thoughts around this. And so we've heard that, getting the vaccine helps to protect someone who receives it by lowering their chance of them getting COVID-19 if they're encountering the virus. Yet some communities of color, have yet to receive the vaccinations. And so many of us have been thinking about this in terms of hesitancy, but I heard it a little differently yesterday. So I would love to get your thoughts on what you think around hesitancy, and if it is there, the why behind that, and what else is it if it's more than just hesitancy. And I'll go with you, Dr. Carson.
Okay, sure, I'll start. So I think we have to be careful about our language. And this is just broadly in speaking about it. And some of the earlier work was really sort of focused on classifying communities as just being hesitant to the vaccine. I think what you're alluding to is really considering what is going on when people are asking questions. I think we should encourage people to ask questions about vaccine so that they are able to make a decision about whether or not that is something that they want to choose to do. And so I like to think about it as encouraging people to ask questions so that they gain the information so that they can make that informed decision. The hesitancy was really around people having questions, right? So how was the vaccine developed? Why was it so fast? What does this mean? Is it safe? Is it effective? And those are all important questions that we should answer as public health professionals, as medical professionals, as community members to help people understand what the vaccine is, why it's important, that it is safe, it is effective, and to provide as much information as we can. So initially, I was wanting more information about the vaccines. But I also know I was able to read the clinical trials when they first came up. So when they were doing some of the earlier trials in it, and I was impressed by the results early on. And so that was comfort for me to be able to share that information with others. It was so I can say, me reading it scientifically, this is a very safe and effective vaccine. And as we move forward, we'll learn more and share the information, but we'll also be willing to tell you what we don't know, right? And to provide that information to people. And so I think just giving people the information and being open to their questions really is a better approach than really casting entire groups as hesitant to take the vaccine.
Love that. And I would love to hear your thoughts on that, Alethia.
Sure. Dr. Carson raised some really great points, and I completely agree. And it's really in line with some of the work we've been doing. So you mentioned that I chair our COVID vaccine equity task force, and one of the pillars that we work under is education and information. And so knowing, to Dr. Carson's point, people have questions about the vaccine. And so it's really a great role that we can play in helping to answer those questions and inform them. We are utilizing our pharmacists as trusted healthcare professionals to answer those questions. We're also partnering with local community-based organizations that are trusted. And so whether that's civic organizations or others, again, to engage as people have questions to really help walk them through that and to provide real-time information as well of kind of where we are in the vaccine state. And I think it also just speaking to people where they are, and people like to receive information in different ways. So whether it's healthcare professionals or being more innovative about it as well. We just did a program, Roll Up Your Sleeves, on NBC on Sunday, where we had President Obama, we had a host of other sort of sports entertainment, and political figures. But one of the poignant pauses in the show was really walking through what Dr. Carson just lifted up. How is the vaccine created? What's been the efficacy behind it? Recognizing that people have those questions, and that's good. We want to encourage people to ask questions about their healthcare as a whole in order to be their own advocates. And this is one way that we're seeing it. And so it provides us an opportunity to provide them with that information and hopefully encourage them to get vaccinated.
Yeah, I love that. I mean, there's something about looking at this groups of as if they're a monolith, like we're just really, everyone feels this way because of Tuskegee experiments. And just really, I think I'm not allowing people the opportunity to ask the questions. So thank you both for that.
And I'll just add, we'll probably see, as far as it not being a monolith, because we'll see differences with age groups as well, even within the same ethnic or racial categories, but we'll see those differences also. And so really drilling down and seeing where the questions are coming from and the differences as they're asked. So as to just to highlight, not to kind of categorize, but to really be mindful and listen to the questions that are being asked.
Absolutely.
Dr. Carson, you do a lot of research, as I stated earlier, around cardiovascular disease and diabetes. And so how would you, in your research, or how do you look at racial disparities there and how they present themselves, not just in the quality of life, but obviously in length of life as well? So if you could talk a little bit about that.
Yeah, so thank you again for the question. So most of my work focuses on type 2 diabetes in particular, which is the most common type of diabetes, and the cardiovascular complications that come from, so heart disease, stroke. Essentially, what I've been doing really throughout my career is really trying to understand particularly why Black adults are more likely to have diabetes, and then also more likely to develop many of the complications. And the complications include not only stroke, heart disease, but also kidney disease, also leading to amputations, as well as vision loss. And I want to highlight really sort of both aspects that you pointed to. The quality of life. All of those complications affect someone's ability to really function in their day-to-day life. So whether it's at work, whether it's at home, whether it's in their community. And really for diabetes in particular, the complications of vision loss, of amputations, what that means for someone to support their family when they're having to go through all that, but then also stroke, right? And so if someone's able to survive or recover from having a major event like that, the recovery following that. Those are all quality of life issues that can really impact someone's ability to function. The other aspect that you raised is the length of life. We know that people with diabetes really are at higher risk of dying sooner. And what we also know, particularly in my work for Black adults, is that the development of diabetes is earlier in life, which means that the longer you have it, right, the more you're likely to have these complications and to die sooner. And so my work is really focusing on understanding not only why is that happening, but what can we do to prevent it? Because while we're focusing on individuals, and in my work, people with diabetes, I also think about this as generations and families, right? So these are mothers, fathers, aunts, uncles, and we also have to think about the children, because when parents have diabetes, we know that their children are more likely to develop diabetes as well. So thinking about it not only as the quality of life and the length of life for the individual, but the impact on the families is just as important. And so thinking about how we can prevent diabetes and really help people to live very full and long lives, but also to promote health in communities and their families.
So again, more of that education within communities of color, and specifically Black families, it sounds like.
Yeah, absolutely. And combine that with really our communities, right? So, there are some individual factors that people will talk about, but it's also setting up the environment so that people are given the opportunity to really live that healthy life. And so We can talk about where the locations of supermarkets are, where the locations of certain resources may be, and how that can help people to really work more towards prevention and healthier aspects that can prevent diabetes, prevent high blood pressure, prevent all of these negative complications.
Thank you for saying that about like grocery stores and things, because I think sometimes people forget that. It's like, well, no, they just don't want to eat right. It's like, nah, maybe there's grocery stores in the community. Let's work on that issue. Thank you for saying that. So Alethia, due to the current pandemic, health crisis, and I know you're not from Alabama, but you don't have to be for this one. I know you know that many are losing their incomes as a result, and also health coverage. Here in Alabama, we are one of 12 states that has yet to accept funding to continue Medicaid. And we know that without Medicaid, an estimated 340,000 Alabamians face losing their health insurance. These eligibility gaps leave many without an affordable coverage option. When I was growing up, I grew up in Chicago. Walgreens was really the staple in the community, and still is. And I know Walgreens gives back to the community. You spoke about that briefly a moment ago. So what is Walgreens doing to really help those that underinsured or uninsured community member around the country?
Sure. So, we do a number of things in that regard. One, we have a number of specialty pharmacy locations, and these really deal with people who have high touch disease states, so HIV, AIDS, rare blood disease disorders, and others. And a large percentage of time by those pharmacists are actually spent either getting coverage approved, helping those individuals find funding sources for the prescriptions that they need, whether that's through a manufacturer or other kind of third-party organization. And so really taking the time to help patients navigate that and find ways for coverage for their care. We also have, I would say, if people are sort of underinsured, we have a prescription savings club, which helps to lower prices of prescriptions. And from a legislative front and a policy front, one of the areas that we are advocating are a number of proposals to help reduce drug prices at the pharmacy counter, because people often abandon prescriptions if they are unaffordable. And unfortunately, a physician doesn't know that someone hasn't filled their order until they end up in an ER or with a health crisis. And so really trying to help bridge the gap and ensure that people are able to be adherent to their medication regimens. So looking at that from a number of fronts, including the policy arena.
That's good. That kind of folded in my other question around how you are increasing patient access in terms of pharmacy services. And so I think that is really great. Are there other things that you are doing around that specifically around pharmacy services?
Sure. So we are a number on the policy front. We have been advocating for pharmacists to be included as Medicare Part B providers, because what we know is that we, out of our 9,000 stores, about 48% of those are in medically underserved areas and health professional shortage areas. So someone may see their pharmacist more than they see a physician at times. And pharmacists are able to provide a number of services, especially with respect to disease state adherence and testing. And so wanting people to have greater access and really pulling pharmacists further in to the healthcare delivery team. So that's one way that we're doing that. And then during COVID-19, with our testing, as well as we're doing a number of off-site vaccine clinics, so going into community to further reach people who want to receive the vaccine. And so sort of localizing that even more. So those are a few things that we're doing currently.
That's good. That's increasing that access. Dr. Carson, will you discuss the work you are doing at UAB around diversity, equity, and inclusion? And I said students, but correct me if I'm wrong on that. I'm not sure if it's just students that you're working with, but students who are, how are they being prepared to recognize and address racial and ethnic health disparities?
Oh, absolutely. Thank you. Yes, I do work with students. So we have both undergraduate and graduate students in our public health programs here. And part of really our focus on training our next cadre of researchers, public health practitioners, policy makers, advocacy, persons who are doing advocacy, whatever the work is preparing them by providing them the foundation of understanding not only the health disparities, but also understanding the drivers of the health disparities. So our curriculum, we revised one of our core curriculum this past year, and that incorporated really a historical aspect of racism and recognizing that our students are coming from different places and different understandings. And so rather than making the assumption that we're all talking the same language, it's providing that information to them so that they understand really not only just the history, but the background for the communities that they will be going to work and advocate for. Also, what we're doing is helping our students to ask questions and to really think about not what we're doing now, but how things should be. And I think giving them really the foundation and understanding of public health is going to be important, but also as they go out into the communities, as they go out into their different workspaces, as they go out into really the world, preparing them to ask those questions as they are making decisions, as they are determining sort of what is going on in these different settings. That's where we're going to be able to have that impact. And so that's how we're preparing our students for that.
Thank you. And this kind of rolls in, and Alethia, I'll ask you this question because there's something about, being a person of color, obviously, and wanting your healthcare provider to get you, right? to get you. And there's a whole thing about how we dress when we go to the doctor. So the doctors, take us seriously, and, our pain is our pain. We want people to understand that. And there's a lot of issues there. With people of color and their doctors who may not be of color. The Equal Justice Initiative, which is EJI, reported in 2020 that Alabama has one of the highest maternal and infant mortality rates in the country. The report also notes that women who develop cervical cancer in Alabama are more likely to die than in any other state. Alethia, can you talk about the impact of health disparities, specifically as it relates to women of color? And really, this is for probably both of you. And, what can we do by way of advocacy to really see change in this area? I'll start with you.
Sure. It's really interesting to the point that you raise, and that sort of health disparities and racism and the types of treatment that people receive as a result of their race, and sometimes of cultural, I'll say, incompetency potentially. And it's an issue that I first became aware of even when I was in high school, and my sister had a autoimmune. She was diagnosed with a Guillain-Barré, which is an autoimmune disease, and that placed her in the hospital. She was at her first year of college for 4 months. She was lucky because, one, she fully recovered, but she also had a family that could advocate for her. My grandmother was a nurse. My sister was in medical school at the time. I visited her every afternoon. But there was another young woman who was there about the same age or younger, who didn't have relatives who visited her, who ended up in the hospital after having a street fight. And so it colored the way people viewed her, and it colored the way the healthcare that she was receiving, quite honestly, that we could witness. And so you look at all of those aspects that play into how people are cared for. And I think, there are a number of factors to that. One, I think representation matters. And so diversity in workforce. I think we are at a pivotal moment because, again, the light has been shined on health inequities. And so really beginning to push those and all of the factors that play into the type of healthcare we receive, because it's not just science, it's also married with the culture of wherever we are receiving that care. And if it's a culture of racism, then that's the type of care that people receive. And so looking at those barriers, you mentioned maternal health specifically, and there's a big movement federally that Vice President Harris is leading with respect to Black maternal health. She's introduced, or not introduced, but when she was in the Senate had introduced this, and it's still alive now, the Monolith Act, and it looks at Black maternal health, and it has a number, it's 12 bills rolled into one. What's beautiful about them is that they address it in a very holistic way. And so looking at the social factors that influence maternal health and trying to address those, whether that's nutrition, to food, whether it's a prenatal workforce, funding community-based maternity health organizations, and even transportation to prenatal healthcare visits. And so looking at all of the factors that play into a Black mother's health while she is pregnant and after she delivers the child. And so we really have to look at it from a holistic perspective, that what's driving those health outcomes, because the outcomes we're seeing right now are not adequate.
Agree. Did you have something to add there, Dr. Carson?
Yeah, absolutely.
Questions in the chat? Yes.
Yes, no, I absolutely agree with what Alethia stated. The only thing I'll add is more on the research side, is that I think now the research focus is coming into play to look at this holistically. So the Centers for Disease Control and Prevention, the National Institutes of Health, so those are our major funders for our research in the United States. And both of them have essentially said, we need to study racism, right? And we need to study how we can implement, whether it's programs, policies, and other avenues of how to address it. And I think that really is going to be important, so that it's really a dedicated effort to understanding the experience of Black women in particular, but also other race and ethnicities, and how we can affect not only the healthcare system, but our communities to promote health and well-being.
Absolutely. And I'm going to the chat here, and there's a question about our local health department. And we have seen, or some have seen, that if there's racism there, what actions can people take? So I guess if people are seeing or recognizing some level of racism at their health department, what would you recommend people do?
So I think there are two things. So I think one, there are health departments that are recognizing and making the declaration that racism is a public health crisis. I think that's important, because that shapes how they're functioning as health departments. So how they're collecting data. If you think about COVID-19 very early on, when they were releasing data on who was being affected, one of the first questions people came out was, where's the data by subgroups? Where's the data by race, ethnicity? Where's the data by sex? You need people asking those questions. And so that's why it's important for local health departments to make the declaration so that it affects how they're operating, right? Because they're providing these services, they're providing these education awareness campaigns. So I think that's one piece of it. I think the second piece of the question is, we have to address racism within our own institutions and organizations, right? So it's one thing for us to sort of say racism has negative health effects, and we're going to work to eradicate racism in communities. But we also have to do the same thing within our organizations. And that takes leadership. And it takes time, but we're moving, right? Moving forward. Part of that is really having those uncomfortable conversations initially about what are the things that need to be changed within organizations. There's a lot right now going on with pay equity, really promotion, tenure, things that really affect not only people within the organization, but also really the decision-making within the organization. And I think those are going to be key areas going forward that can put us on the right path toward addressing racism within organizations, but also within communities.
And then there's another question here. For those Alabamians who will be affected by the loss of Medicaid, what options will they have for healthcare? How would you suggest citizens who will be affected or who have family members that will be affected advocate for, within their state? And so, Alethia, I think I'll go to you just in terms of the whole advocating and how can people advocate for themselves?
Sure. So I would say with respect to that specific question, one, finding your local, I think, representative, whether that's a city council person, whether that's your member of Congress, because they often have caseworkers. And so raising the issue because it provides them with some of the anecdotal or true life information that they need, whether it's to introduce legislation, to push for an expansion, and to help direct their constituents to other healthcare services, whether that's charitable organizations that are providing some sort of coverage for healthcare because that is available, or other institutions that may be able to provide a source for that. And so I would say definitely finding other organizations or elected offices that can kind of help navigate through the system, but also then help also draft policies to try and address that in longer term. So whether that is to expand Medicaid in some way or to create additional funds for coverage.
Thank you. And so I think actually, Dr. Carson, you stole my thunder on this next question, which really is, I'm just kidding, which really is about addressing that, like looking internally at your own institution before you can talk about, working with others or being fair to others. So Dr. Helene Gale, who's the president and CEO of the Chicago Trust Fund, said in a recent op-ed that our public health institutions cannot effectively combat the race-based health inequities that plague our nation until they address the issues of diversity, inclusion, and equity in their own walls. And I would say that extends beyond just obviously public health institutions, but what else do you think there? I mean, does this resonate with you as well in your own maybe institutions? And now, Alethia, since I have you want to?
So I think it's a great point. Representation matters. I'll say it again, representation matters for so many reasons. And so having a diverse workforce is incredibly important in healthcare and across other institutions. And so it's important with respect to cultural sensitivities in healthcare. Cultural and linguistic appropriate services are critical. If we look at our workforce, 45% of our Walgreens pharmacists identify as non-white. And that's important because they reflect the communities that they serve. It's been important as well during COVID, as I mentioned, in having people. Data has shown that people want to hear from trusted healthcare providers who look like them. And so being able to deploy and utilize those professionals as well. And so I think it's, again, it's important, and it's not, none of the things that we've said here are unsurmountable. And they are all things that can be done and can be metric driven so that we can see progress over time. I know we've said and put a lot of things out that need to be addressed, but they're all things that we, if we are taking a conscious effort to do so, we can across various institutions.
Yeah, I'm hearing intentionality.
Yeah.
Sure, is that Dr. Carson?
Absolutely. I'll just say the intentionality. Yes.
It's important, right? To, not just talk about it, but, in order to be about it, you gotta do something. So institutions, in systems, there are individuals who make them up, but on an individual level, what can people do right now to, there's some advocacy work they can do to address this public health crisis. Any advice that you would give to address the public health crisis as an everyday citizen? And then elected officials, how do we encourage our elected officials to recognize this as a public health crisis?
Let me go to first or Alethia?
Yes, please, Dr. Carson.
Okay. Yes, so great questions. So I think it's everyday citizens. What you're doing now, watching, learning, right? And asking, how can I help? How can I get involved? And that could be everything from working in community to advocating on your job for different changes, to talking with your local representatives, really getting involved and asking those questions. And that's where it starts. For those of you who are in leadership roles, making the tough decisions, right? And being bold in it. So whether something's been done the same way for 20 years, okay, now we can change. Let's look at doing this differently. Who are we allowing to make decisions, right? Who are we missing from those decision-making discussions? Who can we invite in? And so really disrupting really some of the things that have been going on for some time. As far as elected officials, I think paying attention to the entire community, hearing those voices, as Alethia said, those stories, right? But hearing all the stories, right? And being intentional about hearing all the stories and resonating with the stories, right? For people who don't look like you, who may not be from the same area that you're from, but hearing those stories, listening, and then responding and figuring out a way how you can actually address the needs of community and what that will take going forward.
Thank you. Alethia, what about you?
Sure. I feel like Dr. Carson has said it so well.
Think about the elected official.
Right. So one thing I will also say is being mindful of our own health. Because I do think that is sometimes overlooked, and not that we are being negligent, but being our own advocates. When something does not feel right to you. And so continuing to press on that in order to be mindful, again, of our own well-being. And so whether that's keeping notes in a tablet before your doctor's appointment so that you're able to say, well, this is what I've experienced. This is when I've experienced, because maybe you don't present the same way that someone else would who has, or the textbook way for a particular disease state or so. And I that just resonates with me, because over the last, I think, 4 months, I've had numerous people who are in my same age group who, have passed away. And so saying, like, let's be advocates for our health. And then I would definitely, to sort of pivot to what we can do. Elected officials, of course, are always are good starts with respect to making our stories known, because also elected officials don't know unless you tell them. And often they'll say, like, I didn't know this was an issue, but I began to hear about it from my constituents. And they said, this is what they are seeing. And so definitely advocating and sharing those experiences with elected officials in order to sound the alarm, because your boots on the ground. And so you know what's happening to yourselves and in communities and what you are consistently seeing as an issue. So definitely making that heard and finding strength in numbers to find other organizations, community-based organizations that are advocating for the same thing, or are serving in the same way you want to serve, and either become a volunteer there or work with them through those systems to try and help impact change. And I'd end with, yes, this is definitely the time for uncomfortable conversations. They are desperately needed. They don't feel good to anybody, especially the person who's initiating it. But let's begin to have those and kind of, again, shed light on the things that we're seeing that are not right.
Thank you for that. And you mentioned physical and mental health. And so these are just some interest questions here. And what do you two do? You two amazing women do to maintain your physical and mental health, what you would like to share. So Alethia, I'll stay with you here.
Sure. I start each morning with prayer and meditation before I get out of my bed. It's just something I do in the moment of stillness before all the busyness of the day starts, and to really center myself. And I can tell the difference when I don't do that. And so it's something that I definitely value. And I exercise gratitude every day. I picked up a book a couple of years ago, and it's Everyday Gratitudes. And it's really just looking at just simple moments and starting with that mindset of gratitude. And then just physically jogging, probably dancing in my living room, which I do often, and walks with my dog.
Love it, love it. What about you, Dr.?
Yeah, no, I was gonna say absolutely. My faith centers me for my mental health, but I also take mental health days. I need them from work, and it's just a break. You know, when I first started working years ago, one of my supervisors at the time, she talked about these mental health days, and I was like, "What is that?" You know, I'm a student out of graduate school. I'm like, "What are you talking about?" And she was like, "It's just days when I want to break. I don't have to go to a doctor. I just want to break." So I kept that going, even now.
Good, good.
So if I was tired, I'll take a Wednesday off and not do anything, or just do what I want to do that day. So I do incorporate that. As far as physical health, it's going to be interesting. So the last year, I haven't been doing much physically. But I start back this afternoon with my personal trainer. I'm a little scared.
After a year off, but look at you.
Yeah, I'm a little scared, but that's what I'm starting today. So
Good for you. Yeah, well, you know, you get a pass this last year, okay? I think, you know, we can have a little bit of a pass there. So
yeah.
Well, you both have achieved so much in your careers, and just want to have you share with us, what are you most proud of? I know these are tough questions. I know it's a hard one. I can't even think of that one, but you know, what are you most proud of and why? And Dr. Carson, you want to think on it?
So broad. I mean, I guess it depends on what I'm thinking about. I guess career-wise, what I'm most proud of is seeing my students going into their own particular areas of interest and expertise, seeing them grow, seeing them develop, seeing the light in their eyes, the optimism, the hope. It's encouraging, right? Because, you know, after you do this for so many years, you see some progress. It's never enough progress, but you see some progress. But to see students coming behind with the energy and really with the optimism, I'm so proud of that, and just proud of what they're doing already. They're pushing us to be better now. And so seeing that and just knowing that we're in good hands going forward, I think is what I'm most proud of.
That's fantastic. What about you, Alethia?
So yeah, big question. But
yeah, I promise you that wasn't mine. It's a tough one.
You know, there's one thing that COVID has kind of taught me, which is to be in this moment. And so at this moment, I am most proud of my vaccine equity work. It's truly restorative for so many communities that have been overlooked and undervalued. And it really makes me think of the parable of the Good Samaritan in the Bible. And so just the work that we're doing and the opportunity to serve our neighbors in a very global sense. I've visited a number of vaccine equity clinics across the country, and they're like clinics where we are administering 5,000 doses at churches. And I go and I always expect to see the same, but I always see something different as people are seeing neighbors they haven't seen in months and are walking out and are excited and talking about how they're going to go visit relatives. I'm going to go visit my mom for Mother's Day. I haven't hugged her in over a year. And I can't wait. And so doing that kind of work is true service. And so that's what I'm most proud of at this moment.
Oh boy, I mean, both of you do such incredible work in our community. So as we're winding down here, I think, and I'm not sure if I have a couple of questions in the chat or not, but I am just wanting to know, what would you like to leave us all with? And we know that we've all agreed that racism is a public health crisis, and we want to see us get to the other side of that. So what is it that you would like to leave our audience with today? Maybe some words of inspiration and hope. And Dr.
Absolutely. No, I I think this is great. So thank you again to the YWCA, to Dr. Magras for the invitation. For our audience, I think stay involved, join with the YWCA, right? Their mission, eliminating racism. Right? So it didn't change this year, right? This is the 15th year of standing against racism. So joining with the YWCA, but then really sort of taking that to where we are, right? In our homes, in our neighborhoods, in our workplaces, and having these conversations, joining people in. Hey, let me tell you about the work that the YWCA is doing. Let me tell you about some of the work that Walgreens is doing. Let me tell you about the work that's going on here. And really bringing together that collective effort. And again, we don't have to do this in isolation, right? We can work together. And I think it's about partnering with others to really advance the work. And so that's what I would leave people with is you have partners out there. Let's join together and we will move forward.
Thank you, Dr. Carson. Alethia.
I'm going to piggyback on that because I love the idea and the aspect of partners, and you really do, and it's so true. A partnership one with this wonderful organization. Thank you for hosting this discussion. And I think one of the things we've seen through the pain of the last year, though, are partners and allies. And so I would say seize this moment. Definitely, you don't have to do it alone. And there are so many organizations that you can be a part of, like the Y, that's doing this work, but others as well. And so this is a moment, right? It's a watershed moment. And as much as we talk about racism and it's an uncomfortable conversation, it's not pleasant. But the fact that so many people are talking about it at this time, let's come out of this moment better than we came in it, and again, just seize this opportunity to do so.
Thank you so much. And it is really good to know that you're in partnership with people. And you're right, none of us can do it alone. And so thank you both for spending time with us today in this important conversation. And as we continue to soldier on, all of us, to really see real change in our communities and in systems that we know need to change. So there's much work to do. Please visit our website at ywcabham.org and take the Stand Against Racism pledge and join us in the fight to eliminate racism and change our systems and institutions. Follow or tag us on social media at YW Central AL using hashtag #WhyWeTalk for more information on our upcoming Why We Talk episodes. Until next time, take a seat at the table, listen, but most importantly, speak up. Thank you all so much for being here, and thank you to our panelists. I appreciate you both.
Thank you.
Thank you for having me.
Thank you.